Well, the CDC has confirmed 2 cases of the coronavirus here in Florida. We did want to let you know that we're taking your concerns and what questions you have. Fox 4's Rachel Lloyd is on Facebook Live listening to your questions right now. She's taking them directly to a doctor at Lee Health where we find her live. Rachel, some good questions coming in.
Yes, Jane, there are a lot of really good questions coming in. And I actually still have some questions from the last Facebook Live, and I want to make sure that I'm getting to as many concerns that viewers have. So again, I'm here with Dr. Stephanie Stovall with Lee Health. I'm just going to go ahead and get straight to Facebook. One person, Madeline, says, should there be a concern for those that happen to be in the ER where one of the victims was located? She says she asked because her coworker happened to be in the ER at one of the hospitals yesterday. What do you think about that?
So the fortunate thing is that we think that most people who are having casual contact with others are at very low risk of actually contracting this virus. So unless you were right up in someone's face or sitting immediately next to them, you're probably just fine, and I wouldn't worry about it. But either way, we want you to watch for symptoms.
Good, good. And then Michelle is asking, how can she talk to her kids about this?
So I think this is an ideal opportunity to educate your kids about washing their hands, about trying to have good practices of respiratory etiquette, covering their cough, covering their sneeze, throwing Kleenexes away after they use them, not touching things that aren't theirs. All of those things are important things to educate our kids about, both right now with this virus and every respiratory viral season.
Good. That makes sense. Just educating them, educating. That's what we're trying to do too. I know that there's a bit of concern, some panic. We want to make sure that people are aware and not scared, right? Zach says, my 2-year-old daughter has pre-existing conditions. Should we consider keeping my son home from kindergarten, and they live in Naples? What do you think about that?
So I think at this point that the best thing is to talk to your pediatrician. It really depends on what the underlying conditions are, how big of a risk that may be. And so I would say talk to your pediatrician and stay in contact with your local health department, either online or through the phone, because they'll know if there are closures or immediate concerns in the area.
Got it. Good. Well, we have our health expert here, Dr. Stephanie Stovall, but it sounds like she's saying you want to make sure that you are consulting with your personal doctor. You can also get information from the CDC. They've been tweeting pretty frequently. The Florida Department of Health is also a very good resource for information. And we'll be sure to try to answer as many questions. Feel free to send those in, keep sending those in, and we'll get those answers to you as best as we can. I'm Rachel Lloyd, live in Fort Myers, Fox 4 in your corner.